Konnichiwa guys, so let's start studying lymphatic drainage of lungs. So let's see what this shit is about. Lymphatic drainage of lungs. So I'll make this one diagram. Right now, lymphatic drainage is of superficial plexus, made of superficial plexus and deep plexus. Right, so both of these drain into bronchopulmonary nodes or hilar nodes, and then these hilar nodes further drain into bronchial nodes, and then they drain into pre and paratracheal lymph nodes. Then these later on drain into supraclavicular nodes. Okay, so now let's talk about the arterial supply of the lungs. These arterial supply comes from two types of two arteries, bronchial and pulmonary. Pulmonary is from the pulmonary trunk, whereas the pulmonary arteries, there is one on right and two on left. Okay, the right comes from, like we studied, comes from the third posterior intercostal artery. Two on left. These are branches of descending thoracic aorta. Okay, now let's go on venous supply. There is bronchial vein and then there is pulmonary vein. Bronchial vein there's two on right and two on left. Azygous, accessory and hemiazygous. These enter the left atrium. Nice. Now there is this one MCQ question as to why the right lung is more prone to infection than the left lung. Because right lung makes 25 degree with the midline, whereas left lung makes degree of 45 degree. So infections enter the right lung better than the left lung. Now there's this one very important question called bronchopulmonary segments. Right, so what are bronchopulmonary segments? First of all, let's go with the definition. These are well defined, pyramidal, wedge shaped, anatomical segments aerated by tertiary bronchus. Okay, now features are very important. Features. First of all, like in the definition, each segment is aerated by tertiary bronchus. Then second, they are pyramidal. They are well defined, anatomic, functional. They are well defined, anatomic, functional, and surgical sectors of the lung. They are anatomic, functional, and surgical sectors of the lung. Then each segment is pyramidal in shape. Pyramidal in shape with its apex towards the root of the lung, with base directed downwards. Then comes the fourth point. Each segment has its own lymph node, bronchial vessels, and segmental arteries. Segmental venules are present between adjacent pulmonary unit of bronchopulmonary segment. Number 6, these bronchopulmonary segments are important for bronchial resection during surgeries to isolate a particular segment in case of an infection. So, surgical resection. Alright. Now, bronchopulmonary segments of right and left lung. Both have 10 segments, whereas left lung only has one fissure, that is horizontal fissure, whereas right lung has both type of fissures, horizontal and oblique fissure. So, based on that, it has 3 lobes and left only has 2 lobes. Okay, so it has upper, middle, lower lobe. It only has upper and lower lobe. Alright, that's how it is. Now the upper lobe consists of apical, anterior, posterior segments. The middle lobe consists of medial and lateral lobe, whereas the lower segment consists of superior segment, posterior, medial, posterior, basal, anterior basal, medial basal, posterior basal. Yeah. Lateral basal, posterior. Whereas in the left lung there are only upper lobe, and upper lobe is divided further into upper division and lower division. Okay, and B lower lobe. Okay, now the upper lobe has apical, anterior, posterior lobe, whereas the lower one has a superior lingual, inferior lingual, whereas this lower one has superior, medial basal, posterior basal, anterior basal, lateral basal. So this is the only difference in the entire lobe thing. Right, so drawing the view of it is like this. This is a right lung. This is apical, anterior, posterior. This, and then comes the medial, comes superior, medial basal, posterior basal. Whereas in the this is the apical, anterior, posterior, superior lingular, inferior lingular, then comes the medial basal, posterior basal, and superior. Right. Now going a little bit deeper into the development of respiratory system. There are something called pharyngeal cells, which leads to secretion of TBX4 factors. Which leads to the formation of laryngotracheal groove for the laryngotracheal tube. And then there are 17 generations of bronchial division, and respiratory bronchus and alveoli are formed. So that's how it is. Now let's talk about some clinical anatomy of lungs. First of all, there is something called Pentecost tumor. Okay. Now what is Pentecost tumor? It is the tumor of apex of the lung. Now typically we know whenever tumor happens, it leads to compression of the structure surrounding that organ. So we know the apex of the lung, it is 2.5 centimeter above the 1/3 the medial of the clavicle bone. So we know which structures pass the first rib, right? So first rib or the clavicle. So we know there is T1 nerve, and there is a recurrent laryngeal nerve, and then there is superior vena cava. Now when there is compression of the T1 nerve, it basically leads to Horner's syndrome, which basically we know what Horner's syndrome is, right? Horner's syndrome is basic. So Horner's syndrome, we know meiosis, ptosis, anhidrosis, then loss of ciliospinal reflex, right? So yeah, that's how it is. So this was the Pentecost tumor when T1 is compressed. When recurrent laryngeal is compressed, we know there is dysphonia, hoarseness of voice. When superior vena cava is compressed, it leads to the increase in the venous pressure, which might lead to varicoses and conditions like varicose vein. Right. Leading to cyanosis. This was a Pentecost tumor. Now there is lobe of azygous vein. Sometimes azygous vein passes through the superior lobe of the right lung, separates a part of lobe by a fissure. This separated part is called lobe of azygous vein. It is not true lobe because it does not have separate supplying bronchus, artery and vein. So what makes a lobe a true lobe? It is not a true lobe when it has its own separate bronchus, artery, vein supply. Okay, but this lobe, due to the azygous vein piercing the superior lobe of the right lung, it's not a true lobe. Now use of bronchopulmonary segment is for resection during surgery in infection of one segment. And there is something also called carina. It is a hook shaped process. It's a hook shaped process projecting backwards from the lower margin of lowest tracheal ring. Projecting backwards from the lower margin of lowest tracheal ring. Alright. And it helps to divide trachea into two primary bronchi. Now there is something called postural drainage. Now carina is a sensitive area of the trachea. Okay, so when the patient is made to lie on his or her left side, secretions from the right bronchial enter towards carina due to the effect of gravity, and since carina is sensitive, the patient will cough. It will stimulate the cough reflex. And the sputum is brought out. Right. Now there is something called bronchiectasis. This is due to widening of airway due to progressive loss of elastic fibers and smooth muscle. And then there is bronchial asthma, and then there is emphysema. Right. This is a normal airway. This is the bronchiectasis with increased mucus. And bronchiogenic. Carcinoma. It can affect liver, brain, kidney, and vertebrae. Because it spreads to bronchopulmonary, lymph node, and supraclavicular nodes. Through the bronchopulmonary and supraclavicular lymph nodes are stated in the body. So this was a lung